Melissa Jones is with us from Bar High. And oh my goodness, she was recommended to me by someone who saw her speak at a symposium on parks and coronavirus right after the shelter in place happened. And then when I had the pleasure of speaking with her in person, I was like, there are so many relevant things she could bring to the table with what we are trying to do today. So I'm not going to take any more time away from her and turn the mic over to Melissa.
Thank you, and good morning, everyone. I'm thrilled to be here talking with you today because I know that this is a group that cares so much about parks and knows so much the value that parks add to our lives. And so this will be a really pleasurable conversation to have. And you know, I think a year ago, any conversation we would have been having about park access would be so different than the conversation we're having now. So it is also just a pleasure to be able to talk to you about the sort of urgent needs around parks that have arisen since COVID-19. So I will just go ahead and get started with the intention of saving significant time for questions and conversation. So park access, COVID-19 and beyond, practices for keeping parks open and engaging communities to create a healthy and resilient region for us all. I come to you today from Bar High. Bar High is the coalition of the Bay Area's governmental public health departments. There are 11 Bay Area public health departments charged with ensuring the most health for the most people and paying particular attention to the most vulnerable. They have been in the news more than ever before with COVID-19 and have been a big part of helping communities reduce transmission risk and stay safe. At Bar High, as their coalition focused on health equity, we really specialize on the experiences of communities of color and places where health has really been jeopardized or shown up in differences in life expectancy, and in particular in places where public policy decisions are part of what compromises health, to create a different set of policy conditions in the basket of things we need to create a healthier environment. You know, park access during COVID-19 is part of the many great paradoxes of COVID-19, which is that this is an experience of a worldwide pandemic. So we're all in the same situation more than ever before. All across the world, there were closures of business, more people working from home, a whole range of new concerns, studies, and research to understand what COVID-19 was and how to keep people safe from it. And so in many ways, it can feel like a universal experience, but it is not. The burden of COVID-19 is being borne very differently for different communities across the world, across the country, throughout our state, and here in the Bay Area. And perhaps one of the most challenging aspects of COVID-19 is that it really exploits historic inequities that have contributed to challenges we've had in terms of health differences for years. And I just want to give you two to think about before we go into the conversation about parks. One is the very well documented difference in wealth, the sort of wealth gap that people talk about by race that can be tracked back to differences in levels of inheritance from one generation to the next. And that can feel historical, but it's actually quite present and quite present day. And it shows up most commonly and so substantially in issues around home ownership, right? So many people, I'm sure, in the crowd today purchased their first home through support for closing costs from their parents, or even maybe a whole support for down payments from their parents. And in many places, your parents had that money because they were able to take advantage of government programs at a moment in time that those programs were actually restrictive, right? And they were able to get into housing, accumulate wealth in that housing, and then pass it on to you for your own purchase. For families where that doesn't happen, home ownership where they have been over time locked into lower paid work, or exiting from institutions like slavery where there were whole periods of time where wealth was not created for communities, we see much less access to generational wealth in a way that creates less access for down payments and for upfront high housing costs, and has people end up in crowded housing. Not only in crowded housing, but also in neighborhoods that have experienced differential investment over time. And that usually means less parks, less access to grocery stores. All of these things have a huge contribution to differences in health, but in this moment also have a huge contribution to differences in access to open space when it's been more important than ever before. And so that access to open space is what I want to talk a bit about today. There are three big reasons, I call them our big three, that access to open space is so important during COVID-19. The first is that safe access to state, regional, and local public outdoor spaces are important during the shelter-in-place order in general. People need places to go, to get out, to be out, and I know that this is not the group I need to say this to, but in large part it's because access to open space has physical and mental health benefits to reducing anxiety and reducing the risk of cardiovascular disease. And in a time when many other kinds of exercise facilities are not open, open space is the way, especially if you're in a smaller apartment, in a crowded living space, to be able to be physically active, free, and mentally relaxed. And keeping parks open right now ensures that low income and communities of color have access to open space and the ability to socially distance and recreate. And that's just such an important thing for this particular moment, as I know you all know. And the story I'm going to tell you today is the story of the choices that we get to make as communities and as public policymakers in the public sector when in opportunities that we have to choose health. Because public health directors and parks directors across the region, very shortly after shelter in place, really did a lot of work here in the Bay Area to keep parks open and keep parks open to an extent that we've seen them open different than other places around the country. That's something that we're quite proud of. And we think it's an important precedent for moving forward, this high primacy of the importance of parks. And so shortly after shelter in place, as people were learning more about COVID-19 and coronavirus, we were thinking about what are the ways for open space to remain available to people and for transmission risk of COVID-19 to be low. And the health directors and parks the two health officers, deputy health officers from the Bay Area and parks directors from around the region came together in a series of internet meeting calls to talk about what is the real transmission risk, how can we keep our shared commitment to parks and access for all, and make sure that everyone has access to park space in this time. And they really did a lot of work to do really pragmatic decision making that could keep people safe and keep parks open. And they really considered these equity concerns. The first one I mentioned already, access to parks. Access to open space in low-income neighborhoods is disproportionately less than it is in higher income neighborhoods and higher home ownership rate neighborhoods. And so the option to keep parks open was an option to choose a health promoting practice for those who most need it. The second piece is that there was some effort to close parks so that only local neighbors would be able to go to them. And I think there was a real acknowledgement and understanding that that kind of thing, which might have been well-intentioned by some of the people who were thinking about it, was something that was going to cut off access to a whole group of people who would be disproportionately impacted, in particular communities in low-income communities of color. The second equity concern that we have to consider for COVID-19 and promoting health that intersects with parks is this equity concern around crowded living. And so it's important to consider people's access to outdoor space, regular activity, and fresh air during shelter in place. And many people, particularly low-income people of color, are living in crowded housing in the Bay Area. And that crowded housing means a lot of people are very close together for long periods of time and need to get out and about. And for any of you who have young kids at home, you know all the added complications and need for that open space. The third is equity concern number 3, which is that we are experiencing during COVID-19 increased levels of anxiety and heightened stress. And access to open space becomes particularly important for families needing space to spread out, play, and relax in the context of that stress. The other thing that we know is that after the initial periods of stress that occurred at the launch of COVID-19, we saw increases in calls to domestic violence shelters, calls to domestic violence lines. And so to have ways for families to get out and spread out becomes increasingly important in that time. And so with a commitment to think about how to reduce transmission risk at parks, the parks directors had one last consideration, which is about equitable enforcement. And so there's a wealth of data that tells us a bunch of people in a room can be doing the same thing, and the citation can go disproportionately to people of color. And there has been test after test and research study after research study focused on a variety of law enforcement entities and citation givers. And we've seen that in a number of these studies. In one, just in particular, focused on public spaces related to transportation, we see extreme racial disparities in issuing citations, and on BART, where Black riders are 12% of the overall ridership, they're receiving half of the quality of life citations. And so parks directors across the region came up with a whole set of items that could be helpful for thinking about the social distancing needed at parks. I'm not going to go through them all with you today, but we have them in a brief that's on our website, and happy to share with anyone who's working on their own work around parks or local open space to keep it fully accessible to a group of, to larger groups of people, or to more people, excuse me. And here are the items here. There are everything from making sure you have reminders up around social distancing so people know to social distance, and then having the reminders dispersed throughout your open space so that as people walk and listen to their music or walk and talk, they are reminded over and over of the social distancing recommendations. It's the same way we see the grocery store reminding us about keeping space, because you have these habits of standing in line that move you more close to each other. And so these kinds of visual reminders help keep us further apart. And so at the end, I'm going to conclude on these comments about why access to open space is so important. I know you all know that. And just say that our overall recommendation as the Coalition of Health Departments is to provide safe, equitable park access that facilitates mental and physical health and health behaviors, to keep our parks, trails, and beaches accessible to all, for state and regional parks to be an access point for those with that state and local parks are a very important access point for people who don't have access to local parks, and to understand that particular role in the ecosystem of parks and how important that is for equity, and that there are ways for social distance to be enforced that are equitable. Now, before I move to the next piece, I just want to say a couple of things. I know that so many people throughout your county and throughout the Bay Area have already been working on equitable parks access. And we are in this moment where there are decisions we could make quite quickly to make sure parks stay open. And then there's this second piece, which is about the long-term planning to make sure that parks access gets more equitable in general, right? That more neighborhoods have parks, more people can enjoy the outdoors. And so I want to just note that there's another guide that you can find from Barhai for those of you who do public space planning, parks planning, land use planning, that's about how community planning can support better resilience, including better access to open space. It's built on an initiative that Barhai has operated for the last 2 years to pilot community planning focused on resilience. Through community partnerships all across the Bay Area. You see some of the folks involved in that here. And there are 7 best practices that are essential that have come from that learning that we think could transform the way we do resilience planning in a way that creates a stronger base, a stronger, more diverse base for resilience planning, and a deeper connection to health and the considerations of health as we plan for resilience. These 7 practices are here. I won't take you through all of them, but I'll take you through a couple so that we can get to some questions. I see they're coming in. It's hard for me to both read the questions and read the slides, so I'll do this and then we'll go next. But in focus on budgeting wisely for community engagement, budgeting in the ways we budget for everything else, expanding engagement through partnerships, particularly intergovernmental agency partnerships, co-designing the process with community, making engagement activities accessible and relevant, identifying locally meaningful vulnerabilities, prioritizing community-supported resilience, and providing transparent follow-up and continuity. And I'll share just one thought on the kinds of planning we could do that could create health, more open space access, and stronger resilience across our region, which is a quote from Roxana at Nuestra Casa. If you want an inclusive process, you need to include funding in your budget for the local community groups to collaborate with you. Please value our expertise, our local relationships, and our time. Don't hire consultants and then ask us to do the work for free. And for those of you who have been part of a planning process, I'm sure you're quite familiar with the sort of process where a consultant is hired and then they ask community groups to provide a lot of the input they need, but don't resource the community groups, which are often smaller groups with extremely large networks, but who could really use the support to have staffing in order to meet the demands of the planning processes. And so budgeting wisely and effective for community engagement in the same way that we would budget for other kinds of planning endeavors really provides the opportunity for more community engagement. That engagement can be really expanded in the way that we just talked about the health officers and parks directors working together to increase access to parks during COVID-19. And those perspectives on what do the parks directors really need in order to create more access to parks, and what do the health departments really have to offer in terms of knowledge, in terms of promoting health, can be really powerful. Third, a co-design of the process with community can mean from the beginning that you have a fully engaged, full process with really deep new understandings and knowledge, and not just a set of surveys that tell you that people want the same things you've maybe heard before. But instead, this deep process can give you a sense of how to get to those things that maybe you've talked about getting to for a long time, but haven't had yet. The other priority that I just want to name is priority 6, which is prioritizing community-supported resilience actions around articulating values, seeking out community solutions, and adopting inclusive evaluation criteria. And so I'll end here because I see there's a number of comments coming through with recommendations for how we go from the COVID-19 moment of parks access to the long-term access to parks and open space that matter to all of our communities. And that's building the funding pipeline for engaged community engagement process that can get to solutions on what all the communities need, to condition resilience funds on the engagement of communities who are most impacted, and to mandate robust engagement at this particular moment when so much is at stake. And then to create standing infrastructure in terms of agency budgets, staffing models, and long-term partnerships with community groups so that there is a way to really be durable for the long term and to withstand these sudden crises and co-occurring disasters we're experiencing now, like the heat waves, COVID-19, and the fires. So thank you. I think I'll stop there. And shall we go to questions?
Sorry about that. I had a little technical blip there for a second. So first, I just want to let people know we're getting some reports of power outages in a couple parts in Marin County. So people are kind of popping on and off. And the first question I see is, can you share with us places where planners and folks who run planning processes can access resources about how to make them more inclusive and collaborative.
Absolutely. So we have this piece here that I'm sharing with you now will be on our website. It's www.barhi.org. And it's an overview that actually includes case study vignettes and other examples to demonstrate the tools, the guidelines that I just shared.